Burlington on the Spot. Today we have Kevin Stansbury. Thanks a lot for coming in.
Good afternoon. Thanks for having me.
Yeah, it's a little bit of a drive, so I appreciate you making time to come down.
Not a problem.
I thought we'd start out today by just going over a little of your background and your history and telling us how you ended up out here as CEO of Lincoln Health.
Okay. So I've been in healthcare for 35 years. I worked primarily in community hospitals across the country. Spent a good share of my career in Cheyenne, Wyoming. Started out at the Catholic Hospital in Cheyenne, DePaul Hospital, and then we put the two hospitals in town together and created one hospital. From there, I went to Carson City, Nevada, and in Carson City, that was kind of an interesting story. They were building a brand new hospital, and I got hired to help them build this new hospital. So we completed the project, and I really loved that part of the business, and started looking for other work, and my wife and I got contacted by a company out of Michigan to build and run a hospital in Bangladesh.
Oh, wow.
And so we went to Bangladesh to help them get started on the hospital, and that didn't work out, but it shows how things progress. When I got back from Bangladesh, a friend of mine called me and said, hey, if you want to build hospitals, because the story is, sorry for that, I was in a taxi cab in Dhaka, Bangladesh, and there was a architect in the front seat, and I was in the back seat. We were traveling together, and he started talking about this fellow that I knew also. So we exchanged good thoughts about this gentleman, and when I got back, this fellow called me and said, hey, that's what he did. He built hospitals, and we'd love to hire somebody like you. So I went to work for them for about 10 years, where I just traveled around the country building hospitals in the United States. When the economic downturn hit, our business dropped a lot, and I was then hired by my last client in Butler, Pennsylvania. And my wife and I moved to Pittsburgh, just north of Pittsburgh, and really loved the community and loved the area. And we worked there for about 5 years. And toward the end of my time there, my older brother passed away suddenly. He was 58 years old, and he died of an aneurysm, died at his desk. And that really caused me to start thinking that, wow, life is too short.
Yeah.
So I went to work for another small company, and we built hospitals around the world. And I did work in Vietnam, and I did work in Nigeria and Ethiopia. We had a contract to rebuild the healthcare system in Libya. So we were doing all of this really interesting international work. And I had always promised my wife that I would never put her at risk for anything.
Right.
And the last trip I made to Africa, I was in Nigeria, and we were surrounded by armed guards the whole time.
Holy smokes.
And so it was like, this isn't much fun. Shortly after that, we had another opportunity in Vietnam, and I went to Vietnam, and we actually were planning to move to Vietnam when I was contacted by the folks that were looking for the CEO at Lincoln Community Hospital in Hugo. And I was at home in the United States when I got the email, and I showed it to my wife, and she said, well, your grandson lives 90 minutes from there. Maybe that's a better job to take than the job in Saigon, which is where we were going to go. And so I was traveling in Saigon, and I actually had my first interview for the job from Saigon. We did it by Skype. And when I got back to the States, we came out here, and my wife and I just fell in love with the area. We are from, she was born and raised in western Nebraska, and I was born in eastern Wyoming. So
Okay.
this is all just us.
Yeah, you're used to this.
Yeah. So we fell in love with it. Now all 6 of our grandkids live within 90 minutes of us. So
that's awesome.
that's great. And we love the community. We love eastern Colorado. And it's just really, really worked out. So that's my professional background.
And I told you I was going to, before we started shooting, I told you I had a question because I was looking LinkedIn, checking it out. First of all, I had no idea that you had been all around the world trying to build hospitals. I mean, so it's been a passion since you were, what, like a little kid? Or
Well,
yeah. Right? I mean,
because
that, you know.
Yeah, we did that. That is because you make such a huge difference. So the first time I traveled to Vietnam, we were consulting on a cancer hospital, and they were struggling with their infectious rates. And so we were talking to the hospital director. Their physicians are generally well-trained. They're generally Western trained. But they were trying to figure out why their infection rate was so high. So we said, okay, well, let's take a look at it. And he said, we have semi-private beds. And we said, well, that's pretty common. We don't think that should be a problem. Well, when they meant semi-private beds, they were putting 2 patients in a bed because they were so overwhelmed. And of course, you can imagine that caused a lot of infections. So just some simple stuff about that. You make a huge difference with just making simple observations and asking folks to do things just a little bit differently.
Trying to make a difference. That's where that stems
from.
And then I saw you went to the University of Wyoming.
Yes.
And then, so were you were studying healthcare then at that time?
Yeah, so I graduated from the University of Wyoming in 1981 with a degree in actually personnel administration.
Okay.
And then I went to work at DePaul Hospital in Cheyenne as their director of human resources.
Okay. I went to CSU. So
Did you really?
Yeah, so I'm familiar with
I brought my Wyoming.
Are we going to put some Wyoming stuff on here? Okay, and I'll put on my Rams mask.
So we'll just remind you that
you guys have had our number
the last 4 years.
Yeah, you guys have had our number the last
football,
few years.
But basketball, you have kicked our heinies.
Yeah, that program was doing a little bit better.
Yeah.
But so then I saw you actually went back, right? And you got your law degree?
Yeah, when I was working for the hospital in Cheyenne, they asked me to go to law school. And so I went to law school at the University of Wyoming, and then again worked at that hospital in Cheyenne for several years after that.
Wow. So you're bringing so much experience and knowledge then to this role. I mean, because it's administration, but it's also traveling all over the world, seeing what it's like to try and start a hospital and take care of patients. So going into COVID, I mean, that's probably the most pressing thing right now, as far as what's been happening over the last 6 months, right?
Yeah. So COVID is a very unique challenge for our healthcare system in general, but in particular for rural hospitals. Rural hospital like our hospital in Hugo, like your very fine hospital here in Burlington, we all offer a broad range of services to take care of the communities that we serve, but we don't have a lot of resources. In Colorado, for example, this data is probably 2 years old, but 2 years ago, hospitals in the city were making an average bottom line of about 14 to 15%. Large hospitals in the resort areas and in the larger rural areas were making a bottom line of about 12%. Small critical access hospitals like our hospital here in Burlington, our hospital in Hugo, Cheyenne Wells, Eads, Ray, Yuma, the average bottom line for those hospitals is a loss of 1%. So we struggle to maintain the services to make sure we're taking care of the communities that we serve, but we're operating under huge financial stress at the same time. But we're also held to the same standards. So the care that you get here in Burlington or in Hugo or Cheyenne Wells or Eads or wherever, you're going to get the same standard of care in those hospitals as you would get in the larger hospitals. We don't do everything.
Right.
I was just meeting with your hospital CEO, Darcy. We're never going to do open heart surgeries, for example, at either of our hospitals. That's ridiculous to even think of that. But there are plenty of things that we can do and do safely. And none of us want to do any care that's pretty good for a rural hospital. We want to do care that's pretty good, period. Okay. And that's the mission that we have. And it's exacerbated by the financial challenges. So when COVID comes along, we see the cost of our supplies increase dramatically. So personal protective equipment like masks and gloves and gowns, the prices of those have accelerated dramatically. Our CFO told me last week we're paying 5 times for a mask what we did just 6 months ago.
That makes no sense.
Supply and demand, yeah.
Right, but I thought we ramped up the supply, right? Once we saw this happening, you hear stories of all the companies jumping in, like GM making ventilators and stuff. I mean,
the prices, it's an opportunity.
Okay.
So many hospitals, especially the smaller hospitals, are on what's called an allocation. So we can order whatever we want, but they're only going to give us what they give us.
Gotcha.
And we end up paying a premium for that. So it is a challenge right now. We are fortunate that we've had limited numbers of COVID cases so far in the rural areas, but I really believe it's coming.
Okay.
And we have to be prepared for that. So we're maintaining our staffing. We're making sure we have the appropriate supplies and equipment on board. And we'll be able to take care of patients. If they get real sick, of course, then we have to transfer them into the city. But we'll be able to take care of a lot of the patients here in the rural areas.
So do you think it's the season changing, where you're thinking that's why you said you see it's coming, or what makes you believe that?
Yeah, so I think it's a combination of things. If you listen to the national experts, it's first of all, the return to school. There's concerns about increased infection as a result of that. The colder weather, as you mentioned, will drive people inside, so we're more than likely going to be potentially infecting people more. And then that's combined with what's expected to be at least a normal flu season,
right?
Which will increase people's possibility of getting sick with COVID as well.
So a multitude of factors. Yeah. Okay. And to prepare for this, I had a chance to go in and look at the interview you did on, it was, I think, 4 months ago, April 2nd, maybe on Fox.
Okay.
Where they interviewed rural hospitals. Yep. And so that was a great interview. Part of what you said on that was we would be ready if COVID overran the big cities. Yeah. We would be an option for elective surgeries, right? And so how has that worked out? I mean, or has it just been horrible, right, that we can't do elective surgeries out here, so that's hurt the bottom line even more? And was that like a confluence of negative factors hitting at once? Or
Yeah, so a number of things happened. First of all, rural hospitals were exempted from the elective surgery issue. But a lot of patients said, I'm not going there. I don't want to get sick. And so we saw all of us, and I'll speak to who I mean by all of us here shortly, but we saw reductions in our clinic volume and on our procedure volume by 40 or 50%. And so we're already operating at a very thin, possibly negative margin. And then we get hit with a real reduction in procedures that we're doing. That hurt bad. What we is the Eastern Plains Health Consortium, which I'll talk about in a little bit.
Perfect.
That's a group of 9 hospitals on the Eastern Plains. We approached the city hospitals and said, hey, stop building these, investing this money. There's a large facility up in Longmont at the ranch, at the convention center, and then there's one on the western slope where the state, and I think it's not inappropriate that they did this. They're preparing for the potential disaster that might hit. But our argument was always use the rural hospitals first. We can take those patients. We can care for those patients safely, and then we'll send them back to the city rather than using these emergency tent hospitals, basically, while the rural hospitals sit empty. So several of us approached the governor's office as well as some of the bigger systems in the state. And for example, in Hugo, we had patients come to us from Greeley, for example, who were recovered. They were no longer positive, but they still weren't ready to go home or ready to go to their nursing home. So we took them and got them better and then sent them home from there. And that's a model we think that we can continue to do through the fall.
So has that helped bridge that gap then financially over the last 4 or 5 months? Or?
It has. It certainly has. It doesn't make up for all of it, but it helps to contribute to some of it. And that's, our motto in Lincoln is neighbors caring for neighbors.
Right.
And so we felt that was our duty. Our partners in the city were being overrun in the spring, where they were, the hospital in Greeley was completely full. Their ICU was full. They had nowhere to put these patients that were no longer critical. They just needed, rehabilitative care to get them back to where they could go home and live independently. And that was us taking care of our neighbors in Greeley, for example. So we accepted those patients. We accepted patients from the city, as did some of the other hospitals in the Eastern Plains Consortium.
So which hospitals are in the consortium? Is Greeley one of those, or?
Yeah, so we have 9 hospitals that are critical access hospitals, so working from the south and going north. Wisebroad down in Eads, Keefe Memorial Hospital in Cheyenne Wells, Kit Carson Memorial Hospital here in Burlington, the hospital in Ray and Yuma, hospital in Holyoke and Haxton, and then the hospital up in Julesburg, as well as Lincoln Community. And then we do have Banner Health is a partner of ours. They're in the consortium, and they're just part of us. And our goal is to just share resources, mainly knowledge. How are you dealing with this problem? What are ways that we can work together to solve that problem? So, for example, when the COVID thing hit, we set up a single number where the city hospitals could call one number. Then we had a case manager staffing that number, and then she would work with the other hospitals in the consortium to see who had beds or who had capability to take care of those patients. So it's that kind of sharing that we try to do. Our primary goal is to improve quality across all of our hospitals, and then also to reduce costs. So, for example, one of the things we're doing that's growing out of the COVID is we've initiated a staff sharing program. So if one of my nurses is wanting some extra hours, but she's only working 40 hours a week for us, but she wants to work some more, and we won't let her because of overtime or the whatever, she could pick up other shifts at some of these other hospitals where she goes there. She's already been oriented to them. She's already been trained. We do enough of the same. That's very easy for her to go to work there and help them out and cover some shifts for them.
Wow, that's fascinating. I did not know that. So you guys must have really good communication then.
Yeah, we meet as the CEOs meet on a monthly basis, and then our financial folks meet on a regular basis. Our human resource staff meet on a regular basis, and our nursing staff all meet on a regular basis.
Okay. So when you look into the future with COVID right now, how long do you think this is going to continue to impact the healthcare system in the foreseeable? I mean, I know you don't have a crystal ball, but what do you think? Are we looking into like next spring, and I guess that parlays into my question about vaccines.
Yeah, and that to me is the key, is the vaccines. Dr. John Fox, who's one of our physicians in Hugo, really studies this problem a lot, and his concern is if we don't get the vaccines going in order to reach the quote-unquote herd immunity, we're going to have to suffer through some horrible things. There are going to be literally hundreds of thousands of people across the country die. Locally, that'll mean thousands of folks dying. It'll overwhelm the healthcare system. So he has taught me that's not the solution. Okay. We've got to get to a vaccine. If we can get a safe and reliable vaccine, and as you suggest, maybe by springtime, the weather's getting warmer, maybe the vaccine or the virus recedes a little bit. We can get folks generally vaccinated, and then we can start building that immunity without folks getting sick. They can do it through the vaccine. In terms of its development, we know that the government and the administration has really committed to putting a lot of resources. They have at least 3 that I'm aware of, different companies that are working independently to develop a vaccine. I was on a conference call last week, 2 weeks ago, with the American Hospital Association. Dr. Fauci was on that call, and he was reporting that he felt by the end of the year we should have a safe and reliable vaccine that would be available for folks to help begin to build that immunity. The next best thing we can do is we can all wear our masks and all practice social distancing. It's not a fun thing to do. It certainly adds some stress, but the more we can protect ourselves and reduce that infection rate, the better. And I think people in Colorado in general, and I'm very proud of our neighbors in eastern Colorado, I think generally people are taking it very seriously, and they're trying to protect themselves and protect their neighbors. That's going to be the secret until we can get a vaccine out.
And use common sense.
Yes.
If you have somebody high risk in your family, use common sense.
That's right. And if you suspect that you've been exposed or you suspect that you have any of the symptoms, get tested. Testing is readily available. I know the hospital here in Burlington has the testing capabilities.
Yep.
Get tested and quarantine yourself until you know for sure.
Okay. And John Fox, or Dr. John Fox, right? He is shooting those videos. We're going to put a link when this goes live. We'll put a link down there so that everyone can go to the YouTube channel and they can see those videos. And it sounds like you're trying to shoot those once a week. Is that what it looked like? It was a 20-minute video, very informative.
Yeah, we do a show every Thursday afternoon at 2:30 on Facebook Live.
Okay.
And then the videos will be posted on our YouTube channel, and it really covers a whole range of topics. We've talked about the basics of, what is coronavirus? What is, how does it affect you? What are some of the symptoms you might want to look for? How do you protect yourself against it? Who should you call if you're afraid you're sick? If you have questions, where do you go? And then we do a lot of just answering community questions on those videos. We've gotten a lot of positive feedback on them.
Yeah, those are great. In regards to, you had talked a little bit about working with the governor or having the governor making decisions. What are the challenges of us being out on the Eastern Plains versus having a state so big and so vast as Colorado, and you have these decisions being made kind of all as one? Has that been a challenge? I mean, in regards to policy, trying to impact both the Western Slope, the Eastern Plains, and more urban areas.
Yeah, no, that's exactly right. And because it is different everywhere. And I think that one of the things that we being the rural hospitals, and especially the hospitals on the Eastern Plains, is be sensitive to what our needs are out here. We're not the same as if you're going to Walmart in Denver or Colorado Springs all the time.
Right.
We're going to live in a different world. So we still want to make sure we're wearing our masks when appropriate. We still want to make sure we're washing our hands. Still want to make sure we're practicing social distancing. But it's not the same problems if you're constantly surrounded by other people.
Okay. And then you had mentioned about the vaccines. I had another question about that. Do you worry? I don't know exactly how long it takes normally to get a vaccine through. I think it might be a couple years, right? Now, obviously, this is forcing us to take unprecedented actions. Do you worry about that? I mean, it being pushed faster or next spring, or as long as we have the testing, we're going to be okay? I mean,
right.
What are your...
I think that's a really legitimate concern, and
Okay.
I know people in general have concerns about vaccines. I happen to be somebody that really believes in vaccinations. Let's protect our kids and let's protect ourselves. I think that what I understand and what I've studied about it, the vaccines that they're developing now, they're following all the safety protocols. What they've been able to accelerate is a lot of the bureaucratic requirements and a lot of the financial requirements. So essentially, you had the Trump administration, to their credit, said, we need to solve this problem now. They found the best companies in the world, who happen to be based in the United States, and said, here's a bunch of money, solve this problem. And so that's in my opinion, that was the best way to do it. The resources available through the federal government and letting the private sector try to solve the problem. And they're going through their testing. And from what I understand, all of the safety testing that would normally be done for a vaccine is being done for these. They're just doing it in an accelerated way.
Gotcha. Well, and what made me think about that was seeing Dr. Fox, because yesterday he was talking about it, and he said, hey, Russia's about to, I think they're making theirs mandatory for the whole population, and kind of that testing then is happening on their population, is what he said, phase 3. So.
That's exactly right. And I think that's where the United States is saying, now, wait a minute, let's do this right. And, it's an interesting question. I've had the discussion with colleagues of mine. Will the government come out and say there's going to be a mandatory vaccine? I don't see how they could do that, and I think that would be the wrong way to do it. We in healthcare, for example, every year, if you're working with patients, you are required to take a flu vaccine or you can't work with patients. Will we do the same thing with COVID? I don't know. But I think that once we get a vaccine out, it's going to be important for all of us to understand how safe it is and what the potential side effects might be. But we are not going to solve this problem until we get the population somehow immune to this disease. And the most efficient way to do that is via vaccination.
Right. Okay. And then as far as the other challenges that you guys are facing economically, is there any other messages that you want to talk about? I mean, going forward, or that you want the public to know out here on the Eastern Plains? Or
I think, and I mentioned earlier about small rural hospitals and critical access hospitals. So whether it's Julesburg or Haxton or Cheyenne Wells or Lincoln, we all struggle to make money on our operations. As I mentioned earlier, we're averaging a loss of 1%. How we keep the doors open is the support of the community. It's tax support. We couldn't, at Lincoln Community Hospital, we couldn't survive without the good people of Lincoln County paying taxes. And it's the same way here in Kit Carson County. So that we're very grateful for that tax support. We're very grateful for the community support. During the time of where the pandemic was really starting to ramp up, we had tremendous support from the community. Just people saying, "Hey, what do you need?" Offering food or supplies, or willing to transport PPE. So it's that kind of support we need from our community, because that's what we do in rural America, right?
Right.
You help your neighbor out, and you take care of folks, and that's how we're going to get through this thing.
Gotcha. What about physicians? Is it tough to get physicians to work out here, or do you think that maybe, because you are seeing an exodus from cities?
Yeah.
I mean, and I don't know to what impact or what effect that's completely true or accurate, but New York, Chicago, I'm seeing every day people are talking about they're packing up, they're moving. Do you think that could be a positive for out here, that there's a chance that,
So I'm kind of biased about that, because I love living in rural
Okay,
America.
so you don't want it.
So no. I actually think it's the other way. When we recruited physicians to Lincoln Community Hospital a few years ago, we had 10 physicians who we had vetted out, and we thought any one of those 10 would work out, and we ended up hiring Dr. Brianna Fox, who's worked out great. No relation to John Fox.
Okay.
It just happens to be they share a last name. What I found in that process is there are a very large group of younger physicians who are looking for lifestyle and not financial reward. So they want to find a community that will welcome them. They want to find a community where they can raise their kids and it's safe. They want to find a community where they can work with patients from cradle to grave, if you will, and really help them manage their health. And I know you've got a couple of physicians here in Burlington who are doing just that. So I think it's really important that when we go out to recruit physicians to rural communities, we find people that our lifestyle appeals to them. Because there are doctors out there that want to live in a rural area, that want to practice good medicine. And these are really, really good doctors.
Yeah.
The doctors we have in Hugo and Lyman, the doctors you have here in Burlington, Cheyenne Wells, Yuma, these are all really good doctors. They just happen to live and work in a rural area.
Yeah.
So we don't have to sell our shelves short. We can get really good doctors to come to rural America. It's just a matter of telling our story right. And we have a great story to tell.
Yeah, and we need to keep getting that message out.
That's right.
Because it's like you said, if you're driving along I-70, or I saw this on Facebook, I think, and you get in an accident, Hugo's right there.
That's right.
Hugo Hospital. I mean, or else you're an hour away from another hospital. We need these hospitals out here. We need this healthcare out here.
That's right. And most people don't realize this, and I share this a lot with our colleagues here in Burlington. When you leave Denver on I-70 and you get west of E-470, the only two hospitals that are on the I-70 corridor between Denver and the Kansas line are Hugo and Burlington.
Yeah.
That's it.
That's it.
So we take care of a lot of trauma off the highways, or agricultural trauma, or whatever accidents might happen. We're there, and without us there, that's a long, lonely stretch of road.
Yeah, it's a big deal. So, okay, well, I really appreciate you coming down here. You're an hour away and sitting down with us. I know how valuable your time is and how busy you are.
Well, thank you.
So I really appreciate it, and thank you, and have a good weekend.
You bet. Thank you.
Okay.
Appreciate it.
All right.
All right.